school, a documentary and health curriculum to teach middle school and high school kids about the condition FASD. Dr. Rich and I already started a blog, www.project.com, and launched it at Churchill High School in Potomac, Maryland, as a multimedia presentation to all 500 graduating seniors in April 2014. This past summer, there were 8 of us interns working with Dr. Rich and taking part in our talk show sessions, discussing several aspects and topics about NPPAE. Our focus as interns is to prevent future generations of alcohol-induced brain damage. Around the country, reports in magazines such as this one from Montgomery County, Maryland, warn us about the epidemic increases in binge drinking for kids as young as 8th and 9th grade. The Behavioral Risk Factor Surveillance Survey and User Risk Behavior Survey from 2011 reported these alarming statistics when questioning high school students about their alcohol use within the last 30 days. So they found out that 45% of students in grade 9 binge drank over the last 30 days. Half of all 10th graders binge drank, 58% of 11th graders, and 62% of 12th graders indulged in binge drinking activities within the last 30 days before they were interviewed. By this time, teenagers are set in their drinking habits and tend to increase their drinking rather than decreasing. That is why we have to educate teenagers before they reach this point and are set in their drinking habits. Just think about this scenario. A guy gets out at a party, texts the girl he's too afraid to talk to when he's sober, invites her to come over and have sex. This is called a booty call. She just came back from a sorority party herself and is not thinking straight, and decides to go over. By the time, this isn't the first time. If we are lucky as a society, he's not passed out or incoherent, meaning he's slurring his words and making no sense. The other unanticipated outcome that foils this plan is his plumbing doesn't work. However, if he doesn't pass out, they have sex, possibly unprotected, and she gets pregnant and doesn't know it. The cycle repeats a few times, leading to several episodes of binge-level alcohol exposure. She misses a period and then stops drinking. Does a doctor ever ask about alcohol use prior to pregnancy recognition? Probably not. The CDC has looked into this and found recently that large numbers of young women seeking abortion have used alcohol prior to pregnancy recognition, and many stop once a pregnancy is diagnosed. The pattern of binge drinking and sex that formed in high school continued throughout college and into adult life. Here's the pink elephant in the room that no one seems to be talking about and preventing. Unintended pregnancy and alcohol use lead to prenatal alcohol exposure, often in large amounts. Half of all pregnancies in the U.S. are unintended, meaning the pregnancy is either mistimed, unwanted, or unplanned at the time of conception. According to a study published in the American Journal of Public Health last year, in 2008, there were 54 unintended pregnancies for every 1,000 women aged 15 to 44. In other words, there were 5% of reproductive age women that have an unprotected pregnancy every year. By age 45, more than half of all American women will have experienced an unintended pregnancy, and 3 in 10 will have had an abortion. And the U.S. unintended pregnancy rate is significantly higher than the rate in many other developed countries. Here are findings from the CDC's National Survey of Family Growth showing the ethnic differences in unintended pregnancy rates. For women who are of racial or ethnic minorities and women with lower levels of education and income, unintended and in 2002 resulted in $5 billion in direct medical costs in the United States. About half of unintended pregnancies are among women who were not using contraception at the time they became pregnant. And the other half are among women who became pregnant by reported use of contraception. Strategies to prevent unintended pregnancy include removing unnecessary medical barriers for availability of contraception and helping women and men at risk for unintended pregnancy choose appropriate contraceptive methods and use them correctly. As noted, there were an overall total of 42% pregnancies that were either unwanted or mistimed, with the lowest among Caucasians and most among ethnic minorities. This data correlates with a study Dr. Rich and Jody Groh alluded showing high rates of NDPIE in Southside Chicago.
So according to the Behavioral Risk Factor Surveillance System survey, it shows about 13% of childbearing age women binge drink. From my perspective as a college student, I think that women during their college years drink a lot more than this. There are many people in college who drink 12 drinks just to start out the night. And a binge episode is 4 to 5 drinks. And if you notice the slide here, about 2 to 4% of pregnant women binge drink, and it seems similar to the 2 to 5% of kids who have NDPIE. According to the CDC, this is the population at the highest risk for prenatal alcohol exposure. And turning attention to one of the factors on the CDC's priority list, alcohol consumption during pregnancy. So girls try to keep up with the boys. They try to challenge them to drinking games or challenge them on a drink off, and the girls get more intoxicated quicker than the men do because they have half the alcohol dehydrogenase enzyme in their stomach than men do. And along with certain ethnic groups such as those of Asian descent, they have a genetic variant of alcohol dehydrogenase that does not adequately metabolize alcohol. So their blood alcohol concentration will be much higher than their non-Asian friends. For women of Caucasian descent, 4 to 5 drinks will give their child full-blown fetal alcohol syndrome. And for women of Asian descent, the amount of drinks will be much less. There are also many more subtle problems related to alcohol use throughout pregnancy. So women should avoid alcohol completely during their preconception period, along with later trimesters and as well as breastfeeding. And unfortunately, some lactation consultants promote the practice of pumping and dumping the liquid gold breast milk so that is so important for the baby's brain development and nutritional value. We believe that women shouldn't try to predict exactly when the alcohol will be no longer bioavailable in the breast milk. And we just suggest to completely stay away from alcohol because you wouldn't put alcohol in your baby's bottle, so why try to risk that? There are many people in college that black out every time they drink, and these are the people that this problem is most dangerous for. In this state, you're clearly not making the best decisions, and the likelihood of you having unprotected sex increases. And that means you could have a possible unplanned pregnancy. Also, keep in mind the timing between conception and pregnancy recognition. And if a woman does not know she's pregnant and binges, she will give her child the full effect of the alcohol and give them brain damage. Most of the government and alcohol warnings focus on pregnant women avoiding alcohol, but what if you don't know you're pregnant? On our first Better Safe Than Sorry talk show, we brought out a bottle of vodka to point out or find the label. First of all, the label was very hard to find. It was small, and it was in red ink that was on a clear bottle. You couldn't really read it well, and the information wasn't fully correct either. So not only should pregnant women not be drinking, but like I've said before, women should not be drinking preconceptually either. So this past September on FASD Awareness Day, we partnered with Planned Parenthood and created these condom bookmarks with condoms attached to it that you guys should have. And we went to the Barking Dog Bar in Bethesda, Maryland, and we passed out these condoms to people entering and leaving the bar, and we put bowls of these bookmarks in the men and women's bathrooms so they can take them as they please. So we think that instead of, well, this was inspired from the Alaska initiative, putting pregnancy test kits in bars, but we wanted to go upstream and do this before the women find out they're pregnant and just give them contraception so that they don't mix alcohol and